approaching care support is comprehensive care management for our high-risk patients rather than using a disease-specific model. We've found that the vast majority of our high-utilizing patients are medically complex with significant psychosocial challenges. To meet the needs of these complex patients, we put together a multidisciplinary team with nurse practitioners and social workers, along with a very strong consultative team, including a medical director, psychologist, and pharmacist. We have been able to adequately address the needs of our patients with the expertise of these team members. Providing support and resources for the patient's emotional and social well-being have really been key in paving the way towards improved self-care of their medical conditions.
Our enrollment process includes purposeful steps along the way. We use a combination of hospital-generated utilization lists along with direct referrals to create lists of potential candidates. If a patient meets criteria, we then obtain an appraisal from the PCP to confirm that this patient is a good candidate with some degree of likelihood that the patient will engage with care support. Our next step is completing an enrollment home visit by both a social worker and a nurse practitioner. This step we have found to be crucial to the success of patient engagement. This gives a big boost to our relationship building, along with giving key insight to the patient's living conditions and family dynamics, as well as medication self-management. The case is presented at our weekly multidisciplinary case conference, and the individualized care plan is created using evidence-based protocol. We then follow the patient longitudinally with regular touches by phone and at scheduled PCP office visits or by home visits if indicated. At 90-day intervals, we review each patient at our weekly case conference. We have found that having a strong clinical team coupled with frequent touches promotes patient engagement, provides patient-centered care, and support for these vulnerable patients.
Care support to me is all about relationship building. We try to meet the patient where they're at and explore what's important to them and what their goals are. For instance, we recently had a patient whose most important goal was to walk her grandson to school, which she had not been able to do in a very long time. She has severe COPD, recurrent chest pain, along with anxiety, depression, and went to the ED all the time. As trust was established, she opened up about her feelings and was open to learning new techniques and coping skills to better manage her mental health symptoms. We also connected her to pulmonary rehab, smoking cessation resources, and provided high-touch support. We were overjoyed to see her out on the street one day smiling and walking her grandson to school. And her ED utilization has been vastly reduced. It's really a win-win program.
I have had the immense pleasure of working with Anne and Lisa from our care support team. Their meticulous attention to details have helped my patients in multiple aspects of their life and allow me to focus on the big picture and my patients' medical conditions. And their vast knowledge of local resources have improved my patients' quality of life. They have been able to make things possible for my patients I did not realize was possible, and I really appreciate working with them.